Most people think burning feet after 60 is just part of getting older. But feet do not burn simply because of age. Sometimes burning feet are a quiet warning from the nerves, and one hidden cause many people miss is low vitamin B12. Hello, I'm Dr. Catherine Blake. Over the years, I have spoken with many adults who describe the same thing. Their feet burn at night. Their toes tingle. They feel pins and needles, buzzing, numbness, or little electric shocks in the soles of the feet. Many of them try new shoes, foot creams, cold water, or thicker socks. Some are told it is just circulation. Others are told it is arthritis or age. But sometimes the real issue is not in the feet. It is in the nerves. Vitamin B12 helps protect the nervous system. It helps maintain the coating around nerves, much like insulation around electrical wires. When B12 is too low, those nerve signals can become noisy and confused. That confusion can feel like burning, tingling, numbness, crawling, or sharp little shocks. Today, I will show you 7 important signs and mistakes that can connect burning feet after 60 with low vitamin B12. I will also explain what is happening in the body, using simple examples so you know what to watch for and what to discuss with your doctor. Let me start with a common story. A 68-year-old woman says, "My feet feel hot every night. During the day, I can ignore it, but when I lie down, it feels like I am standing on warm sand." Her feet look normal. No rash, no wound, no swelling. Her shoes are not too tight. She assumes it is aging, but her blood work shows low vitamin B12. She has also been taking acid-reducing medicine for years, which can affect B12 absorption in some people. Her feet were not the main problem. Her feet were the alarm. 1. It's just aging. The first mistake is thinking burning feet are normal after 60. Many people accept nerve symptoms because they believe aging explains everything. But burning, tingling, numbness, or electric feelings in the feet are not just normal aging. What it may actually be is peripheral neuropathy. Peripheral neuropathy means the nerves outside the brain and spinal cord are not working properly. These nerves travel down into the legs, feet, arms, and hands. When they become irritated, damaged, or poorly nourished, they may send false signals to the brain. That is why a person may feel heat when the foot is not hot, or pain when there is no visible injury. Think of the nerves like electrical wires in a house. Healthy wires carry a clear signal, but if the insulation becomes worn or damaged, the signal may flicker, spark, or jump. Low B12 can affect that nerve protection. The practical step is simple. Do not dismiss burning feet as age alone. If burning, tingling, or numbness is new, persistent, or getting worse, ask your doctor about checking common neuropathy causes, including blood sugar, thyroid function, kidney function, medication effects, and vitamin B12. But this leads to the next mistake. Many people believe they cannot be low in B12 because they eat well. 2. I eat well, so my B12 must be fine. The second mistake is thinking B12 deficiency is only caused by a poor diet. That is not always true. Vitamin B12 is found in foods like meat, fish, eggs, milk, and other animal products. Some foods are also fortified with B12. But after 60, the issue is often not just intake. It may be absorption. Your body has to unlock B12 from food, carry it through the digestive system, and absorb it properly. This process depends partly on stomach acid and a helper substance called intrinsic factor. As people get older, stomach acid may decrease. Some medicines, especially long-term acid reducers, may also affect B12 absorption. Metformin, a common diabetes medicine, can also be linked with lower B12 in some people. Think of B12 like a package being delivered. The package may arrive at the building, but if the front gate is locked, it never reaches the right apartment. That is how B12 absorption can fail. A person may eat enough, but still not absorb enough. The practical step is to look at your risk factors. You may want to ask your doctor about B12 testing if you are over 60 and have burning feet, numbness, balance problems, fatigue, memory changes, a vegan or mostly plant-based diet, long-term acid blocker use, metformin use, stomach surgery, bowel disease, or a history of low B12. Do not stop prescribed medicine on your own. Just ask whether B12 should be monitored. The next point catches many people off guard. Even a normal B12 result may need a closer look if symptoms continue. 3. My B12 was normal, so it can't be that. The third mistake is relying on one number without looking at the full picture. A B12 blood test is useful, but sometimes levels can be borderline. Sometimes symptoms suggest the body may not be using B12 well. In certain cases, doctors may order other tests, such as methylmalonic acid, often called MMA, or homocysteine. These can help show whether B12 is working properly inside the body. This does not mean everyone needs extra testing. It means symptoms matter. Burning feet, tingling, numbness, fatigue, brain fog, sore tongue, or balance problems give important clues. Think of B12 like a key in a factory. The key may be somewhere in the building, but if it does not reach the machine still does not work properly. That is why your doctor needs both the lab results and the symptom pattern. The practical step is to keep a simple symptom record. Write down when your feet burn. Is it worse at night? Is it in both feet? Does it start in the toes? Do you also have numbness, weakness, balance trouble, tiredness, or memory fog? Bring this record to your appointment. A symptom record is like a map. It helps your doctor see the pattern, and one of the most common patterns is burning that gets worse at night. 4. Night burning and pins and needles. The fourth mistake is blaming only the bed, socks, or room temperature. Of course, warm blankets or tight socks can make discomfort worse, but if burning returns night after night, especially with tingling or pins and needles, the nerves may be involved. What may actually be happening is irritation of small nerve fibers. These tiny nerve fibers carry pain and temperature signals. When they misfire, the brain may receive false messages. The feet may feel hot, even when they are not hot. They may feel prickly even when nothing is touching them. They may feel like they are buzzing from the inside. Think of it like a smoke alarm with a faulty sensor. The alarm is loud. The sound is real. But there may be no smoke. The sensor itself is the problem. In neuropathy, the burning is real, but the foot may not show an outside injury. The signal system is misfiring. Nighttime often makes this more noticeable because the room is quiet. During the day, your brain is busy. At night, there are fewer distractions, so the nerve signals feel louder. The practical step is to create a simple night routine. Check your feet under good light. Look for cuts, redness, swelling, wounds, or color changes. Keep sheets loose. Avoid very hot foot baths, especially if you have reduced feeling. And if the burning keeps returning, do not rely only on cooling creams. Cooling may calm the feeling. It does not find the cause. And when burning begins to come with numbness or balance changes, it becomes more important. 5. Numb feet and poor balance. The fifth mistake is thinking balance problems are only about age. Your feet are not just for walking. They also send information to the brain. They tell you where the floor is, how much pressure is under each foot, and whether your body is leaning. When nerves are affected, that feedback becomes unclear. A person may feel less steady in the dark. They may need to watch their feet on stairs. They may touch the wall when walking down a hallway. This can happen because the brain is not getting clear messages from the feet. Think of it like driving with a foggy windshield. The road is still there. The car still works, but the information coming in is unclear, so every movement feels less safe. Low B12 can affect nerve function, and in some people, this may contribute to numbness, tingling, or coordination problems. The practical step is to take balance changes seriously. Use good lighting at night. Remove loose rugs. Keep walkways clear. Wear supportive shoes instead of loose slippers. Use handrails. And tell your doctor if numbness, tingling, or burning is affecting your walking. If you have ever felt burning, tingling, or numbness in your feet at night, comment "yes" below, not to create fear, but to remind others that these symptoms are common and worth checking. Now, the next point is important because B12 deficiency does not always affect only the feet. Sometimes the feet are just one piece of a bigger picture. 6. Fatigue, brain fog, and a sore tongue. The sixth mistake is treating every symptom as separate. Many people say, "My feet burn, but my tiredness is probably something else." Or, "My memory is not as sharp, but that is just age." Or, "My tongue feels sore, but that cannot be related." Sometimes these things are separate, but sometimes they connect. Vitamin B12 helps the body make healthy red blood cells. Red blood cells carry oxygen. When B12 is low, the body may not make these cells properly. This can lead to fatigue, weakness, lightheadedness, or shortness of breath with activity. B12 also supports the nervous system, so some people may notice brain fog, low mood, memory changes, numbness, tingling, or balance trouble. Think of red blood cells like delivery trucks carrying oxygen. If the delivery system slows down, the whole town feels it. The lights dim. The machines run slower. Everything becomes harder. That is how B12 deficiency can feel in the body. Not always dramatic. Sometimes it is a slow drop in energy, clarity, and nerve comfort. The practical step is to look for clusters: burning feet plus fatigue, tingling plus brain fog, numbness plus balance trouble, sore tongue plus weakness. These combinations are worth discussing with a healthcare professional. Do not diagnose yourself from symptoms alone, but do not ignore the pattern either. And now we come to a serious mistake many people make with supplements. 7. Taking supplements without knowing the cause. The seventh mistake is trying random nerve supplements without testing or guidance. This is understandable. Burning feet can disturb sleep and daily life. People want relief. But neuropathy has many possible causes. It can come from diabetes, prediabetes, low B12, thyroid disease, kidney disease, alcohol use, chemotherapy, autoimmune conditions, trapped nerves, circulation problems, or medication effects. Sometimes more than one cause is present. For example, someone may have diabetes and also low B12. Another person may take metformin and have burning feet. Another may have normal blood sugar but poor B12 absorption. This is why the cause matters. Treating neuropathy without looking for the cause is like trying to clear smoke from a room without finding the fire. A fan may help for a while, but if the fire keeps burning, the smoke returns. Vitamin B12 may support nerve health when a person is low or at risk of being low. It is not a guaranteed cure for neuropathy, and it is not a painkiller. It supports the body when deficiency is part of the problem. Some people also ask about alpha-lipoic acid. It may support nerve discomfort in some people, especially those with diabetic nerve issues, but it should not replace medical evaluation. Always consult your doctor or pharmacist before starting supplements, especially if you take medications, have diabetes, kidney disease, cancer treatment, or other medical conditions. Also, be careful with high-dose vitamin B6. B6 is often sold for nerve health, but too much B6 can actually harm nerves and may worsen neuropathy. With nerves, more is not always better. Balance matters. What to do? Next. Let us put this into a simple plan. First, do not ignore burning feet after 60, especially if it is new, persistent, worse at night, or paired with numbness. Second, keep a short symptom record for 1 to 2 weeks. Write down when the burning happens, where it happens, whether it is in one foot or both, and whether you also notice tingling, weakness, balance changes, fatigue, or brain fog. Third, ask your doctor whether vitamin B12 should be checked, along with other common causes of neuropathy such as blood sugar, A1C, thyroid function, kidney function, and medication effects. Fourth, protect your feet. Check them daily. Wear supportive shoes. Avoid walking barefoot if your feet are numb. Be careful with hot water. See a podiatrist if you have diabetes, wounds, thick nails, foot deformities, or reduced feeling. Fifth, support your nerves with steady habits. Gentle walking, balance exercises, enough protein, good sleep, hydration, and limiting alcohol can all help the body function better. These steps are not dramatic. They are practical, and practical steps taken early can protect comfort, balance, and independence. Recap. Burning feet are not always just a foot problem. They can be a nerve signal. And after 60, one hidden cause worth checking is vitamin B12 deficiency. B12 helps protect nerves, much like insulation protects electrical wires. When the body does not have enough usable B12, nerve signals can become confused. That may feel like burning, tingling, numbness, pins and needles, buzzing, or electric shocks. But remember, B12 is not the only possible cause. The goal is not to guess. The goal is to investigate. Now you know that burning feet can be an early warning sign. You know that eating well does not always mean absorbing well. You know that night burning, numbness, balance changes, fatigue, brain fog, and a sore tongue can all be clues worth discussing. Your action step today is simple. Tonight, check your feet. Notice what you feel. Write it down. And if these symptoms are new, persistent, or getting worse, speak with your doctor and ask whether B12 and other neuropathy causes should be checked. Early awareness does not mean fear. It means you are listening before the body has to shout. If this video helped you, subscribe for more calm, practical health guidance. Comment yes if you have felt burning or tingling in your feet, and share this with someone who keeps saying their feet burn at night. Thank you for being here. Take care of your feet, take care of your nerves, and remember, the sooner you notice the signal, the better chance you have to protect the road ahead.